before 60%, 50% of the people that were reporting to our OPD now just need some placebo treatments, some multivitamins, some calcium tablets, and they are good to go.
Okay.
They don't come back for like 5 years to us.
Erectile dysfunction is a huge problem in a man. How much would you say is psychological?
So accordingly, we are able to see, like in the past, what I have read in our books, since like we have a legacy, we have our literature, we have everything. Everyone in our family is made to read that before coming to our the clinical practice. So usually before 60%, 50% of the people that were reporting to our OPD now just need some placebo treatments, some multivitamins, some calcium tablets, and they are good to go.
Okay.
They don't come back for like 5 years to us. So 50% of the cases are psychological. We train them, like placebo treatment is actually a treatment in medical science,
Yes.
In modern medicine. So like other 50% have like the pathological problem, the blockages related problem. The penile blood flow is not up to the mark. The retention power is not up to the mark. Somewhere the quality of the semen, it goes all watery and everything. So a low viscosity problem basically. So all these things are concluding up to a impotency where hormonal dysfunction is not there, but sexual dysfunction or pathological or physical dysfunction is there. People are well built, people have a good weight to the height ratios, but what they are facing is a problem, somewhere a problem that they cannot explain regarding their sexual health. So what I want to say for this, like right now, 70 to 80% of the cases have pathological problems, have somewhere hormonal problems. But 20% of the chunk that we are having in our OPD or in online consultations are basically psychological. The chemistry between the husband and wife is not good. Somewhere these people are facing the time problem. Someone has a late shift, someone has an early shift, and the consumption of alcohol that has increased, the consumption of drugs that have increased. So a natural way of living, natural way, like in nature, connected to the nature, people are not actually spending time. People are in their flats in the same monotony that they were having before. So I think people need a lot of time to connect with the nature along with their spouses, along with the babies, so that you have a natural connect out of the Wi-Fi's and the internets that we are having right now.
Yeah. The entire global village thing has really disrupted the synchronization of a couple. So what would your advice be to those suffering from psychological issues and erectile dysfunction?
So my advice is basically try and evaluate yourself. Like gynecologists say, for the females, if you have a breast lump, if you have something like that, you can have self-evaluation. You can evaluate yourself every day, every week. You should test yourself, and if you feel something, you should definitely go and consult a physician, a gynecologist, a sexologist for that reasons. We have also come up with the portal that is named as Ask Dr. Jain. So there people are really involving, really like coming up to us and getting us to consult themselves, even their small issues. Like, sir, we have like very much low sex life since like a week. So people are even discussing that. So some medicines, some testosterone boosters, some nutraceuticals or dietary supplements, some changes in their lifestyle, some dietary plans, and that is it. Things are getting better. But when it is late, when they like approach us after 2 years, 3 years, 4 years, after handling all the problems, then it is very hard to like tackle them, and it's a long process. So I would like to tell people, consult is the only way out that we can actually, and consult a good doctor, not all the quacks that are up to anything and everything out there, giving you all sort of vigras and everything. Like, I don't know how people are even actually getting onto these things. So maybe consulting a better doctor is a key to success.
Yeah, I think though a lot of people cannot identify a good and a bad doctor.
Yeah, okay. YouTube is a good doctor, I
guess. Yes. I mean, I find myself Googling when I have headaches, so yeah. So the idea is early consultation with a trustworthy doctor, and you should be able to solve your problem easier. Now,
yes.
Ask Dr. Jain. Please tell me more about this.
So AskDrJain.com is a portal where people can consult freely in a 100% confidential manner, because all the new startups, all the things, these people have a data leakage policy, some kind of data leakage policy, that these people give your data to different companies, different medicines companies, different brands. So unlike us, Ask Dr. Jain is a 100% secured portal, because we have a legacy of 100 years. So some 1,000, 10,000, 20,000 data is just a petty number for us. We are more concerned about our image, our legacy, our way of this confidential treatment, like our the prescriptions that we have, that I usually have, that has a QR code on there. So only the person who has the application, designated application of Ask Dr. Jain, only can access to this prescription. So that kind of confidentiality I'm talking about, and we have been making it more easy and easy for the people who are seeking for help. And premarital test, before people are getting married, people can actually get their infertility and sexual life tested just on the basis of blood results, so that in marriage people can be more sure of if the other person is fine, or if the other person is not having any STDs or STIs or any kind of problems, so that they can lead a very healthy married life ahead. So Ask Dr. Jain is all about people and people seeking for sexual and fertile health. That's what we mean.
So AK Jain is all about trust.
Yes, Dr. AK Jain Clinic is all about trust. Yes.
And it's very important that you are encouraging premarital tests, because fear to aram se hoga na, the married life. All these
Just, yeah,
concern about STIs and STDs and whatnot bhi hota hai na. Okay, so which leads.
बहुत सारा होता है.
Yes.
Yeah.
I've heard about a few women experiencing pain during intercourse, even if they're not virgins. What is that?
Yes.
And why would she have a problem later on to get pregnant?
So basically, pain during intercourse. The topic is pain during intercourse. Right. Somewhere, some people, some females have a smaller area, like 2 to 3 centimeters of vagina that we usually have in like pathological aspects. So some people have a smaller vagina. Some people have their hymen intact. So when they actually go towards their sexual intercourse, these people have that level of anxiety in their head. So I will have a pain, I will have some things. And most of the cases, this will be very surprising for you and for everyone. Those are actually getting these problems. Most of the females have some childhood trauma. Like some of the relatives, some of the people must have tried something with them. That childhood trauma is ingrained in their mind. And that is why these people are not able to have a healthier intercourse. Like these people have their anxiety level at par, that they are not able to, you cannot touch the vagina of the husband is not able to touch the vagina of a partner. So these kind of cases actually is reported to me. So we have a different procedure. We have a HIFU technology here at our clinic. So that HIFU technology actually takes the area, cleans all the area. There are some flakes deposited on the vaginal end also. So that are with the rare cases that we are able to see. That also causes painful intercourse or white discharge in females, or some kind of smelly discharge in females, and in turn causing infertility. That's the main reason, yeah.
The relation between, I would say, sexual abuse in this case, it's so connected, right? Everything. And this is something we don't talk about.
Nobody talks about. If someone's uncle, a close uncle, like all the groping and everything is happening, and it's really regular in all the households in anywhere. You can't say India. It's very regular everywhere. So people need to talk about this. Now the good touch, bad touch has started recently. People are teaching their daughter, their son even. So things are happening, and people need to talk about it.
Yeah, I just feel very bad for the people with that kind of trauma and the anxiety level that they must be going through.
So we have a top-notch level of psychologists here, top-notch level of counselors here, who actually give sessions to these females who have had a childhood trauma, and now these people are actually having a very good sexual life. I'm happy that good results are coming to like us, and somewhere some kind of emotional support, some kind of that someone has a non-judgmental view about this.
Yes.
Nobody would say I was like, it's not actually sexually abused. It was just a trauma in the mind that something happened and that thing could happen to me with my husband also. So these kind of anxieties, so basically conquer the mind and in turn lead to infertile or a sexless marriage.
Yes. So all they need is someone to understand them and see them as a person.
Non-judgmental to understand.
Yes.
And experienced also, who can give right way of
Exactly.
right process.
Like with so many of us untrained people, with the best of intention, we end up really hurting people.
Definitely.
Yes, sir. Now, coming to my other question, what is your experience using a sperm washing machine?
It is good and easy. Like I have a big machines also here at my clinic. So I tried this Sohag IUI andro wash. It was a good experience altogether. The people, my andrologist, my embryologist are really happy that they have a very small setup just beside their table. They are able to like make a fertile environment in that area, and it's very easy to clean. It's very easy to like, the disposables are nice. So we have a good experience with that. And we have a good success rate also with that.
Oh, wow, that's amazing.
Yes, we have a good success rate.
So Subhak and Rovash is making a lot of people in your clinic happy, not just your clients.
Yes, definitely it is. Definitely it is.
Amazing, sir. So we've talked about IUI. What are your thoughts on home insemination kits?
Home insemination kits are good, easy to use. People are able to administer it themselves. So, and but some limitations are there for that reason. Some like sterility of the environment, the time of the semen to be like processed and everything. So all these things have a limitation. Not more people. I actually have very less experience about this, very frankly speaking. But who I have talked about and who I have heard in this thing in a conference also, these things have a limitation. So most probably in future it can get better. But if the kids can replace the natural way of conceiving, natural sexual dysfunctions can also be like evolved and catered upon. So things will be better also with that.
Yes, sir. I hope that it reaches that level where there's efficiency in everything that we do. Well, thank you so much, sir. Thank you for your time. You're very busy. Yes. So
it was wonderful talking to you. Very understanding for that reason. Yeah.
It is indeed. And I just want to wish you and Dr. A.K. Jain set up all the very best, not just from me, but from Subhak Health Tech. And I'm sure that you will go on to build centuries of legacy, not just 97 years.
I hope so. All because of your good wishes.
May God be with all of you.
Thank you so much. Thanks a lot.
Thank you.